My name is Nika Seidman, and I'm an obstetrician gynecologist at San Francisco General Hospital, which is affiliated with the University of California, San Francisco. I'm really pleased to be here today with Dr. Geraldine Ekbo, who is also an obstetrician gynecologist with specialty training as a reproductive endocrinologist and infertility specialist. She is a physician at Laurel Fertility Care, and also volunteer clinical faculty here at San Francisco General Hospital. So Geraldine, thank you so much for being with us today.
Thank you for having me.
What we're going to talk about in the next video is something that comes up a lot in care of HIV-affected couples, which is how women's fertility declines over time. Many women who've been affected by HIV have been told over the past several decades that they can't get pregnant and can't build a family. But we have such great data to tell them now that they can safely get pregnant and have children. And so obstetricians like me have been faced with counseling these women about how their fertility changes over time. So Geraldine, I was wondering if you could help me understand, when I see a patient in clinic, how I can talk to her about where her fertility might be at given a potentially older age.
Great question. So typically women present, like you mentioned, after they've been trying for a while, patients that I see, and they want to know what are my chances of getting pregnant. To speak in generally about fertility, we know that it changes with age. So women usually start reproducing or are able to reproduce after they go through puberty. And you have cycles every 25 to every 35 days, and as we get older, typically in your late 30s, we start to see your periods get shorter, and eventually you stop ovulating and you go through menopause, which typically happens at about age 51. And so what we think is that your reproductive potential actually ends about 5 to 10 years before you go through menopause. So if on average you go through menopause at 51, we start to see that usually by 41, sometimes up to 44, women are not able to conceive naturally anymore.
So if I see a woman who is in her late 30s and having shorter periods, is there any type of workup I should do, or how should I counsel her?
Yes, absolutely. So the first things we always want to know about is the quality of the egg. Unfortunately, we cannot really detect quality. The only way we know about quality is the woman's age. So some of the things that we would want to make sure are working well to maximize everything would be that, first of all, there's adequate sperm. The semen analysis by the partner is normal. The woman has fallopian tubes that are open. And then the next question then becomes, what can we do about the eggs, and how can we maximize the number of eggs a woman makes each month? Typically, when those women present in their late 30s, the concern is that quality of eggs are not as good. And importantly, the quantity also goes down. So we're born with all the eggs you'll ever have. So unlike men who continue to have sperm, through their 60s and 70s and continue to make sperm, what happens in women is that the number of eggs you have just goes down every month by a process that we cannot control. And so that's why ideally you want to start when you're younger. But when a woman presents in her late 30s, it's not all doom and gloom. There are things that can be done. We would just want to make sure that all parts are working well, and then we can try to focus on maximizing the quantity of eggs we can get, just so we can also increase the chances of getting pregnant.
Is there an amount of time that you recommend that women in their late 30s start trying before they get an evaluation for infertility?
Yes.
Or, for example, a woman who's over 40?
Yes. Typically, we define infertility as not being able to conceive after 12 months of trying to get pregnant. So time in intercourse at the right time of your cycle for a total of 12 months. After that period, we would recommend that you see a fertility specialist. That number changes when you turn 35. So in women who are 35, we don't want you waiting 12 months. So after trying for 6 months, we highly recommend that you start to see a fertility specialist, because what happens usually at age 35 is that your fertility declines for 2 reasons. First of all, your quantity of eggs just starts to go down quickly, and then the quality goes down as well by a process that we don't understand. And so what we can do by you seeing a doctor, we can do blood tests and things to help us get a sense of where you are and what we can do to improve that, improve your chances of getting pregnant.
And are there things that a woman can do to naturally try and improve her fertility?
The biggest driver, unfortunately, is age. However, when we're faced with a patient who is at an age where things are a little more challenging, the first thing I would say is to make sure we're timing intercourse at the right time. We have over-the-counter ovulation predictor kits that can let you know when you're fertile, and so you would want to time intercourse to happen usually around 3 days around when you're going to ovulate. We also would recommend for people who are having timed intercourse to avoid using certain lubricants that can actually affect how fast the sperm move. That's what we call sperm motility. And so there's certain lubricants that can slow down the movement of sperm. So we would recommend not using those. We also,
are there any specific I should tell patients about?
There are specific ones. So the common KY jelly is not good for sperm.
Oh, good to know.
Actually, just water is helpful. Mineral oil or just even cooking oil, as crazy as that sounds, is actually safer for sperm than most of the over-the-counter lubricants.
Interesting.
We also know that smoking affects how quickly a woman goes into menopause, so which also affects her reproductive potential. So we would definitely not smoke. Avoid excessive alcohol consumption, and generally living a healthy life is always good for pregnancy. It doesn't always guarantee fertility, but I would recommend any interventions or healthy diet, exercise, and things that help you as a person in general, and reducing the amount of stress in your life.
And for me as a primary obstetrician, if I see a woman in clinic, before I refer her to a specialist, is there any kind of baseline workup that I can do?
Yes. I would recommend that every woman who is already seeing her gynecologist to talk about difficulties she's having conceiving should have an evaluation of her tubes. That can easily be ordered by a general doctor. It's called a hysterosalpingogram, and that can confirm if the tubes are open. A semen analysis can also be done for the partner, and there are certain blood tests, such as the follicle-stimulating hormone and an anti-Mullerian hormone that a woman can get checked by her doctor that can give us a sense of what her reproductive potential at that time may be. Unfortunately, there is no one test that guarantees that if this number is good, I'm going to get pregnant, but it gives us a better estimate to help plan.
Great. And then lastly, is there anything specific in terms of timing, of length of time trying to get pregnant for women who are over 40?
Yes. So things get challenging over 40. And what happens over 40 is when I talk about the quality of the eggs, is that each egg has about 23 chromosomes. And usually it's fertilized by a sperm that also has 23 chromosomes. As we get older, there is a degenerative process, a process that affects the number of chromosomes that each egg has. And so you can sometimes end up with too little or too many. And that can affect fertilization, so that even when an embryo is made, you may have a higher risk of miscarrying, and that happens significantly over the age of 40. In our experience, women are able to conceive on their own, usually up to about age 44 to 45. We've never really been able to assist women to get pregnant using their own eggs over the age of 45. And so it is challenging because the more, even though there are eggs present, the quality may not be that great. And so my bottom line is always the earlier you can start, the easier things can be. However, I would still recommend trying when you're financially ready or mentally ready to have a baby, and sometimes that happens later in life. And seeing a doctor, you can get counseling and advice on different ways where we can try to maximize the number of eggs we can get over the age of 40, through using things like in vitro fertilization, intrauterine insemination, etc.
Great. Well, thank you so much for your counseling today and for helping me with so many patients over the past couple of years.
Thank you for having me.
Thank you.